Technical difficulties.
All right, we are live, and we're so excited to have this conversation today with our guests here representing parents and members of the school board. Welcome to a live Q&A. I'm David Plazas, the Opinion and Engagement Director for the USA Today Network Tennessee and the Tennessean, and I'm your moderator tonight. We want to thank the Parent Advisory Council of Metro Nashville Public Schools for partnering with us to put this together. This is a conversation about practical advice, health and safety issues I think people should be thinking about, especially parents and students. Our main guest is Dr. Rosemary Hunter, who's a pediatrician and very involved in these conversations. And we also want to welcome Parent Advisory Council members Kevin Walker and Dr. Berthina Nava McKinney, as well as school board members Christian Buggs, the chairperson of the school board, and also member Emily Masters. Thank you so much for being with us today. And what I'd like to do is ask each of you, and I'll call you in order, just to introduce yourself, and if you have any remarks that you'd like to make to the public, it's a perfect time to do so. Let's start with Dr. Hunter, please.
Okay, so I am Rosemary Hunter. I am a pediatrician here in Nashville for the past 21 years. I am a mom and a parent of a Metro Nashville public school student. And my work is in general pediatrics. I also do a lot of work on food insecurity and social determinants of health in my professional life. So I have an interest in communication and making sure families are familiar and comfortable with going back to school.
Thank you very much, Dr. Hunter. Ms. Buggs, would you introduce yourself, please?
Sure. Thank you for having me. I am Christian Buggs, chairwoman of the Metro Nashville Public Schools Board of Education. I'm one of those unicorns. I'm a North Nashville native. I've been here all of my life, or just about all of my life. Graduated from MLK, then graduated from Tennessee State University, from Vanderbilt University, taught in our schools for 6 years, and then just decided to insert my teacher voice and made my way to the school board. I'm most excited and most maybe tearful about right now the idea that I will be a Metro Nashville Public Schools parent in just 4 days. My son, Christopher, will be walking into the pre-K classroom at Jones, formerly Buena Vista, and I'm excited to connect with other parents.
Thank you very much. Ms. Masters.
Thank you. So I'm the school board representative for District 3. I live in Goodlettsville. I am beginning this year my 12th year as an MNPS parent. I have one MNPS graduate, and then my son will be starting 8th grade. And I am very honored to be the Parent Advisory Council liaison for the school board, which is how I got invited to be a part of this. And I've really enjoyed working with Kevin and Berthina and Bibi, who's not on right now, but who is the PAC chair. I think they're doing an amazing job of advocating and really bringing the community together around being an MNPS parent and how parents can get involved. So I'm happy to be here. Thanks.
Thank you very much. Dr. Nava McKinney.
Hey everyone, good evening. So happy to be here. I am Berthina Nava McKinney. I serve as the co-secretary to the PAC, and also I am the district-wide recruiter. Our goal on the PAC, so just to tell you a little bit about the PAC is a parent-led organization. It acts as a catalyst for parent voice inside each of our metro schools and across our entire district. Our aim is to provide effective involvement of all parents in MNPS, promote healthy communication, and support partnerships with and among our schools, our school district, and community stakeholders who are involved in the education of our young ones. So we're so excited, and we want to thank David Plaza for hosting this and partnering with us, as well as our school board members and Dr. Rosemary Hunter for joining us tonight. And we're so happy to have you. Thank you.
Thank you. Mr. Walker, please. I think Mr. Walker maybe oh,
sure.
There you are.
My name is Walker. I'm a parent here in the Tennessee area, right here in Nashville. Been here for several years. I got glad to be here today.
Thank you so much. We've had a lot of parents send us information. I wanted to start very much with the basics. Dr. Hunter, could you talk a little bit about what parents should be thinking about as kids go back to school when it comes to health and safety? And just as we all know here, the school board met today and agreed to enact a mask mandate come next week when school starts. So would you take us through the basics? What is the basics and how should parents react to this, especially changing information that we've seen over the last several weeks?
Well, this has been a very trying year and a half for everyone involved. And I think that when it comes to health guidance for schools and parents and children, we're always trying to follow the data or the information that we have at the time to make recommendations. We certainly advocate for children to return to a physical presence in school. There is no substitute for teaching our children in person, and we consider educating our children as essential service. This is as essential as me going to the office and taking care of you medically. So we want to take a smart, educated, and data-driven approach to have the environment be as safe as possible. And as a member of the American Academy of Pediatrics, we have advocated the two main tools in our toolbox. We've had these tools for a while now, but number one is wearing masks. So I was very pleased to see that the Metro Schools has now agreed to have a mask mandate for the foreseeable future. Granted, that may change as this pandemic evolves. But as the pandemic got better, we did relax, and a lot of people relaxed mask mandates. But now with the Delta variant and cases are rising, we are seeing more illness in children. We do want to bring the masks back. They are one of our primary strategies to prevent the spread of COVID and protect our children, teachers, staff, everybody. The other main tool in our toolbox at this point is the COVID-19 vaccine. We do not have, there is no medicine specific to treat coronavirus. We need a prevention strategy. So getting everyone who is eligible for vaccines vaccinated is a major tool in our toolbox to reduce the transmission of the virus. So in our approach, in terms of a medical approach, those are the two main things I wanted to emphasize.
Thank you very much. And just a quick question for the school board members. Since you made the vote today related to mask mandates, what considerations did you take into account as you did that? And how are you explaining to parents, especially those who are concerned about masks in school? And we could start with Ms. Buggs and then Ms. Masters.
Sure. So I can say, I've been trying to train my son for the last at least 2 weeks to wear his mask, even at daycare, on the weekends at home, in preparation for school. Because whether we had a mask mandate or not, he was going to be wearing a mask, even if I had to tape it to his face. So I was a bit hesitant to call a special meeting just because I kept worrying about the operationalizing of it. How do we make sure that teachers can effectively support the mask mandate without it consuming them, without it consuming their classroom? What would happen to a kindergarten student if they took off their mask? Do I need to come pick them up? Do they go to ISS? Those kind of questions. But now that we've come on the other side of a mask mandate in public offices or public buildings from the mayor, it makes it just that much more real for the rest of us that adults need to be mindful of their masks, that whether you're vaccinated or not, you need to be continuing to wash your hands and not touch your face and try to keep social distance between you and others. And so I think more than anything, we can empathize with parents. We understand that there will still be who will choose not to, or who will push back, or who will have questions, and we empathize with that. But this is where we are going to stand firm, that this is going to be what science, what best practices say are something that we need to do, and that's a mask mandate. So we will continue to engage with parents and community members and make sure that we have masks available, and we'll empathize. But we've got to make sure, you cannot teach a sick child, you cannot teach a dead child, just like you cannot teach a hungry child. So we're going to feed them, we're going to teach them reading, writing, and arithmetic, and we're going to keep them safe.
Thank you. Ms. Masters, anything to add?
Just to echo what Chair Buggs said, and just to point out that we're following CDC guidelines, American Academy of Pediatrics, the fact that the mayor has implemented a mask mandate in government buildings, and also just following along with deep concern what an effect the Delta variant is having on children. And the fact that Dr. Lisa Piercy just today said she anticipates all of our children's hospitals in the state being full, largely with children affected by COVID, by the end of this weekend. So I think it's not awesome. I sometimes teach dance classes, and I taught some 3-year-olds dance classes this summer. They were in masks. I was in a mask. I promise you, I understand the difficulties. Sometimes their ears are almost like too small for the mask to stay on. But that's why I'm so excited that we're doing this tonight, because that's what this is really about, is how do we make that work so that we can do the thing we know works, which is masking, and do it correctly and in a way that makes sense for children. So I'm going to let Dr. Hunter talk more about exactly how we're going to make that happen.
Absolutely. Thank you for that. And I wanted to talk to Dr. Hunter about some terminology that parents, may be curious about, and that is things like positivity rate. And, in July 1st, there was about a 0% positivity rate on certain days. Today, we're at 17% in the state of Tennessee, going from an average of 60 cases to going to now an average of about 2,500 cases this past week. Could you put that in context and what that means, and why this is so urgent for parents and the community to consider?
So we're seeing a higher disease burden of COVID-19 in our communities. We're seeing more people come through the ER. We're seeing more patients admitted to the hospital. Hospitals around the state are filling up. Not every one of those positive cases, of course, comes to the hospital, but a certain percentage of them are. So the more cases you have, the more chance you can go to overwhelm your hospital and its ability to take care of everyone who needs inpatient care. Did I answer that question, or was there a second part to that one?
Yeah, no, you definitely did. And actually, this
Okay.
leads to something else with regard to masking, because one of the questions that parents had were, what type of mask should I get? Should I wear a face shield? What's the right kind of fit? And if you could answer some questions about basic hygiene as well.
Yes. So in general, we have actually found over time that the fabric masks are actually very effective at reducing the spread of COVID. The fabric masks were the easiest to come by early on. We had a lot of people making homemade fabric masks, and we find them to be colorful. Children are usually easily adapted to wearing these. So I have one as sort of as an example with the ear loops that go over the ears. You can get them sized for children. Of course, they have them sized for adults as well. But the fabric masks are one of the easiest to keep clean and take care of. They're also not too expensive, so the children may lose them. But in terms of efficacy at stopping the spread and protecting you, actually the fabric masks are quite good. I do think they are appropriate for use for the children in school. They can be found in lots of stores, Walmart, Walgreens, etc., online. They also have disposable masks. Some people call these surgical masks or medical masks. These are ones you might find in pharmacies. They do have some sized for children, but I think they're a little harder to come by. Like where I work, we have them in the hospital, but I don't actually know how easy they are to find in your local, let's say Walgreens. But I've also heard that Metro has bought masks for schools, and so at an institutional level, are probably being able to order these type of disposable masks. If your child is having trouble with the fit or discomfort on their ears from extended use, they do make headbands that you can wear with buttons to put the ear loops over, or they do make plastic extenders that can go around the back of the head so that the ear loops are not just staying behind the ear all the time if the child finds that hard. It also will help it maybe stay up, because the fit is a little hard sometimes. If your child has a kind of small face and you're trying to find the right size mask, it can be hard. You want it to cover the nose and mouth even when they're talking, so that they have that protection still going. And then sometimes if you can't find the right size ear loop, there are techniques to twist it over or do a small tie to make it a little shorter, so that you get a good fit on the face.
Thank you very much. And Dr. Nabal McKinney, I'd love to address with you a question that we have had about bullying in schools and how parents might talk to their children, especially if there are situations where, they may not be inclined to wear masks or they may be mocked for that. And what are your conversations regarding this particular issue, and how do you think parents can best handle this?
So my recommendation is, as far as that's concerned, is the better you talk with your child and prepare them for their experience for the first days of school and their experience within schools. It'll give them the confidence that they'll need to go into the school. If there are areas where bullying does arise, I would also encourage parents to create that open conversation so that students feel comfortable coming back to their parents and explaining what's going on within the school. I would also work to build relationships and partnerships with teachers and advocates within the school, as well as school principals, to communicate that information so that we can create environments where bullying can be addressed immediately and dispel any negative effects that it may have on our students.
And just building upon these conversations with parents, since you're on the Parent Advisory Council, Dr. Nabal McKinney, could you talk a little bit about what conversations you're hearing from other parents? What are some of the concerns, some of the things that are keeping parents up at night as they're preparing kids to go back to school?
Sure. So many of the concerns that we heard from parents were around the mask mandate and whether the Metro Nashville Public Schools would actually enact a mandate. Now that we have it, I think it has really reassured many of the parents across MNPS that we are doing the right things and we're putting health and safety at play. There has been some concerns about bullying arising, but that is due to lack of a mandate. If children decide to wear the mask, and we haven't really heard much of the opposite. If students come in without wearing the mask, are they subject to bullying? Other concerns around that is our younger students in learning and acquiring phonics acquisition for reading and literacy, and will the mask inhibit them learning the phonics? And I think today school board member Abigail Tyler brought that concern and asked Dr. Battle to be mindful of that as for students in younger grades. But in general, I think what I have seen even before and after is an overwhelming show of support for MNPS in enacting the mask mandate.
Thank you very much. And Mr. Walker, we're talking about the kinds of conversations that parents have been having with each other about what's keeping up at night. I'd love to hear your perspective as well in terms of what you're hearing, what people are telling you as they prepare to send children back to school next week.
Well, sure. I mean, one of the conversations we have at our house is just coming from the faith tradition we're in, is that we focus on not just about myself, I'm taking care of one another. And that my son, who is 17, he's vaccinated. His part of the reason for him wearing a mask is just to protect and take care of the others around him that may not be vaccinated. So part of it is just a way for him to be of service to the other kids at school. So that's kind of one of the focuses we're taking as a family over here as we look at.
Thank you very much. And Dr. Hunter, I'd also like to ask you about, there's been a lot of parents who've had questions related to or concerns because children cannot get vaccinated if they're under 12 years old, and how best to do that. And in some cases, there have been some parents who've talked about children in daycare. They may be even not ready yet for MNPS and maybe too young, even if the parents are vaccinated, of what are the things that they should be looking out for? What are ways that parents can be protected and at the same time try to be as calm about things as possible?
Yeah, so children will pick up on our anxiety. So we do want to be mindful of how much we talk or share in front of our children sometimes about our anxieties, and make sure we're not being too strong of an influence that way. So the protection for young children is actually not that different than it, has been for the last year and a half. There is not a specific vaccine for them yet. I did check in with some of my work colleagues. The studies are undergoing right now, and they do hope to have some data around opening it up to younger age groups by the end of the year. However, I don't have any exact timeline of when younger children might get vaccinated, or and when that will roll out exactly. So the social distancing, the mask wearing, the avoiding crowds, the good hand washing and hand hygiene, just teaching young children how to wear the mask, and just being mindful of that. And then when they're sick, keeping them home. Don't send them to school. Don't send them to daycare. If they have symptoms, keep them home. Watch them, maybe have them evaluated by a medical provider before you go to school. This is how we protect others. And I agree with Mr. Walker that my faith tradition, and when I go to my faith services on Sunday, that's what I hear. We are here to protect, we are not here just for ourselves. We are here to protect others, and this is how we show that care.
Ms. Buggs and Ms. Masters, I wanted to ask you about, as the school district is preparing for the school year, this is going to be obviously far different from the previous year because it's going to be in person, as far as we know, in person all year. Could you tell us a little about what parents and teachers and children can expect as they go back to school, and what kind of contingency plans you're thinking about in case there's a scenario that is worse than we're at today?
I can start if you like, Ms. Masters. So we have 159 schools around Nashville with the historic investment that was made both by the Mayor Cooper and by families in just supporting our schools as we return to in-person learning. We're able to now have many more nurses than we ever had before. We've been doing a lot of extensive training and supporting of those nurses to make sure that they understand and feel well equipped to do contact tracing, to make sure that they're supporting teachers, to make sure that if we do ever have to quarantine, that we're only quarantining small pods of students or even small classrooms. We were so lucky, blessed, excited to have not had to close down schools once we re-entered based on any COVID outbreaks. We had that contract with Meharry Hospital where we had the contract tracing that was done in partnership with us. But I think it's going to look different for each school and certainly for each tier. What's going to happen at a Warner Elementary School in East Nashville that has a little over 300 students will be very different than a McGavick High School that has several thousand students. So, part of it is just making sure that we offer autonomy to that community and that principal to make sure that they understand how to separate quarantine students or students that need to be contact traced, and those, and just offering supports from the central office or support hub to make sure that we're consistent.
Thank you.
And I'll just add that I know, we've gotten a lot of questions about what happens if a student is quarantined, if a teacher is quarantined. We are under some much more specific state guidelines around what we can and cannot do in that situation. What I know at this point is that students who are sent home for quarantine will receive instruction. I know that from the MNPS perspective, and I know that our academic team is working together to figure out exactly what that will look like within the state guidelines. And I am also told that the specifics about that will be coming out very soon. So I am on the lookout for that as well. But I know that was one of the big concerns among parents.
Well, thank you. Dr. Hunter, there was the perspective for a while that children weren't getting as sick as adults were. We're hearing different things. So could you clarify what is the situation now when it comes to children, especially those under 12 and COVID-19?
Well, it is true that they were not actually the primary spreaders. Unlike other respiratory viruses like the flu, children tend to be the primary spreaders of certain respiratory infections. And that was actually one of the interesting things about coronavirus, that the adults tended to spread it much more than the children. They also tended to have milder disease. So when they did catch it, it tended to be milder, self-limited illnesses. That being said, there are always those rarer cases where it was much more severe disease and a few deaths, but those were much, much less common than the adults. Now, with Delta variant, we are seeing an increase in cases in children, but it also is extremely more contagious. It is unclear if it's a more dangerous variant per se to children, but it is more contagious and a little bit more easily spread between adults and children.
And we've heard about also from the Delta variant. Now there's news about a Lambda variant. Can you tell us about these different variants?
You know what? I am not going to be able to give you a lot of detail there. As a general pediatrician, I'm not an infectious disease specialist, and that might be beyond my pay grade. But they are certainly watching all the variants, and they do have concerns about new, more resistant variants, and then whether or not the vaccine is going to be as effective once you get different variants.
No, thank you very much. And we'll definitely follow up with that. We know we've had a couple of questions in the comments about the severity of the illness. Dr. Nabaa McKinney, if I could ask you as well, just to one of the things that people have talked about is just, risk assessment as it comes to sending their kids to school. There were, from what we've seen in the data, there were many children who did not come to school last year, did not check into school. How are parents discussing these particular issues when it comes to ensuring that their children have an experience where they are showing up to school throughout the year?
Yeah, I think part of the conversation that I have been a part of, I think parents are ready to send their children back to school. However, they want to ensure that their children will be safe and healthy, and minimize any disruption for learning to take place. This has really been a difficult last year and a half for everyone. I have a 7-year-old in school, and the transition has been good and bad for him as well. And so I think returning to some sort of normalcy, I think is what parents are looking for, what our kids are looking for and what they need. So for me, I think it's reassuring to see that Dr. Battle and the board, as well as our healthcare officials, are really putting kids' health and safety at the forefront, so that we can put protocols and things in place to minimize the disruption for students so that they can have somewhat of a normalcy going back into the school year, and in creating an environment where learning can take place. And I'm excited to do so. And so part of that concern for me, just as a parent, with my son being 7, he's not old enough to be vaccinated. So what protocols we're going to be put in place for his health and safety. And so I'm happy for the decision that was being made. I think it's in the best interest of everyone involved. And I think it's a small price to pay for health and for healthy kids and happy kids.
No, thank you very much. And just as a recap, since we've had a lot of comments and questions related to mask mandate, yes, the school board today did approve a mask mandate that was recommended by Dr. Battle, the director of Metro Nashville Public Schools. It is only for Nashville schools. Every single other district has its own policy. My understanding is that Memphis is also requiring masks as well, but most schools around Middle Tennessee are optional. Dr. Hunter, I wanted to ask you about your experience talking to parents who might be hesitant about getting inoculation for children? I've done a lot of work in this space as well when it's come to measles vaccinations, and sometimes doctors are, they're finding ways of how do you have that conversation, especially if they've heard all this other thing, this information. We're in an age of misinformation where we're hearing all sorts of things about what a vaccine does. Could you tell me about your approach and other approaches as well?
Yes, well, we're no strangers to what we call vaccine hesitancy. We see it on a regular basis in pediatrics these days. What's interesting to me is that we're seeing more vaccine hesitancy specifically to the coronavirus vaccine. Like they'll get every other vaccine, but they don't want to do this one. And most of the time, we hear the concern about it being a newer one, that it was rushed through. And hopefully folks have heard this before, but the science behind creating the coronavirus vaccine has been known for decades, and it was in development, and they were able to speed up the process of manufacturing, but they did not shortcut the safety or efficacy of the vaccine in any way, though that part of the trial proceeded along the same trajectory as every other vaccine that we have developed and have recommended. So I usually just try when patients come to me and I'm encouraging the vaccine, I'll usually try and address any questions or concerns if they have them. Some will tell me what it is or share with me. Others don't want to talk about it, like they have their mind made up. And usually I just try and leave the door open, come back if you ever change your mind, and we'll have more discussions about it. I talk about how it was studied to be protective against severe disease. So the endpoints for which it was studied are for hospitalizations and death related to coronavirus. So they did not look specifically at how many people would or would not catch coronavirus or any subsequent variant once you'd had the vaccine. They were looking specifically at what we call severe disease outcomes. So for the most part, if you get the vaccine, you're much more likely to have a mild case, self-limited case, and a full recovery versus the more severe outcomes. And I'll be happy to go over any side effects if you want to hear those.
Sure, yes, please.
Okay, so the main side effects that we see from the coronavirus vaccine include soreness and mild redness at the site where the vaccine is on the arm. You can also have body aches, some fever, or general achiness that lasts 1 to 2 days. There have been reports about a very small number of adolescents who have developed inflammation of the heart after the vaccine for a few days afterwards. Right now, that risk is about 2 people out of every 100,000 doses, which is about the same risk as being struck by lightning. And it is 1,000 times less than the natural infection or inflammation of the heart from actually getting COVID-19. So when you get coronavirus, you're 1,000 more times likely to have heart inflammation than you see with getting the vaccine itself. So far, every indication is that these few cases of the inflammation in the heart related to the vaccine, all those children have recovered quickly with no long-term damage. Unfortunately, with COVID-19, we have seen long-term damage of the heart, even to adolescents. And now I think it's the TSSAA is now requiring all student athletes to get clearance from a physician prior to returning to sports.
Thank you very much for that. And I'd like to turn to Ms. Buggs and Ms. Masters again for a moment. When it comes to the recent report from state data about learning loss and also the kids who are reading on grade level, and what your thoughts are on how to address that this year, and what plans are in place to help children, especially who've gotten even further behind because of the pandemic. And perhaps we'll start with Ms. Masters and then Ms. Buggs.
I'll hop in. So, we had our Promising Scholars this summer, and we still are awaiting some of the results to that. There was some pre-testing and post-testing, and there was some really intense work that was done with children over the summer. We also are implementing high-dosage tutoring, and that again is a partnership with Pencil. You can go on Pencil Foundation's site and sign up, but along with that is some really intensive training for the tutors so that they can be paired with students one-on-one to help them address any learning loss issues that we see. We also have our individual student dashboards that are going to be rolled out in a much bigger way this year so that the parents and students can be really empowered to be a part of sort of tracking each student's individual data and figuring out what areas need to be addressed. We also have, on another end of the spectrum, we have an unprecedented amount of funding going into SEL. And so we're going to be able to sort of get at some of the root issues with students that are hindering their learning in many cases, because we know that social and emotional piece plays such an important role in being prepared to learn and able to learn. And to be frank, for everyone in the school building to understand where they can meet that child where they are and figure out what sort of interventions need to be done. So I think, I know that that's sort of big picture plans, because we're going to have to actually get our hands on the data, also look at our MAP score data that we do within MNPS, to begin that work of sort of planning for each individual child's intervention.
Thank you. Ms. Phillips, anything you'd like to add?
Yes, I could ramble for forever, but I was just trying to figure out how to make my points very concise, because Mrs. Masters did a great job of giving some very specific supports that are going to be in place. But 30% of our students come into first grade already one full grade level behind. That means that schools are certainly where community issues bubble up. And considering that we had a year of tornadoes, plural, we had a year of storms, and we had a year and a half of COVID, we knew to expect that our students were going to be even further behind than they had historically, that families had not been given the resources that they needed, and they certainly weren't given them consistently, but when they got to school. So yes, we have a large investment of dollars from the city, state, and federal government in the form of kind of recovery dollars, ESSER funds that are going to schools. But I really want to highlight the dashboard. That is so important for parents, especially the parent advisory council members, to know, is that the dashboard is up and running so that you can see exactly what your child is supposed to know. So if I'm the parent of a preschool student, I will be able to see what standards in math should my son know? Should he be able to count to 100? And if he does not meet that standard, I then know that I can be practicing that specific skill at home. If it's that he needs to learn how to both say, write, and spell his name, then I need to make sure that he has mastered that skill on the dashboard. And if he hasn't, I know I can practice that later. And I think we don't often talk to parents enough about how to really use data effectively. How do you use it in a way that's not overwhelming, that doesn't make you look at MAP scores or 10 ready scores or other assessments that are just dots on a plot, but instead look at what the standards are. What is it that the state or the federal government says that my child should know by the end of this year? And then how can I make sure that I support his or her growth in that way? And so, we have a slew of other initiatives that Dr. Battle and her team have been working tirelessly, literally from March 2020, to make sure that we could implement consistently with families, like the Navigator program, making sure that we're touching base with families consistently, making sure that we have a better thumb on truancy and chronic absenteeism. We have all those things happening, but I really want to empower parents to ask questions, to advocate, and to really dig into data in a way that says, I'm going to be an advocate for my child because I know exactly how to tackle what they've lost.
Thank you very much. And I have a question. This may be for either the PAC member, for Dr. Dunbar-McKinney, the school board members, or Dr. Hunter. Last year, we saw a lot of clusters from COVID that came from family gatherings, for example. And for now, as we go into this school year, what is the protocol? Should a child be exposed to COVID? What is the best thing that parents should do? Should they keep the child home, or what are the best practices right now?
It is my understanding that if you have a known exposure, you should quarantine, I think, for 7 days to watch for symptoms if you have a known exposure. It does seem like a lot of time, but they have shortened it. It used to be like 2 weeks. Now I think we're down to 7 days. The CDC has specific guidance on that number of days, but and I can double check and look it up. But I believe it's now 7 days to watch for symptoms. And yes, that was certainly around the holiday time. That's where I find that many families are very motivated to get together. And I, see that desire. So luckily, the adults in those adult gatherings can be vaccinated. The children, unfortunately, cannot yet be.
Very good. Any other comments on this particular question related to what parents should know if there is a COVID exposure, or any advice?
My only recommendation is, in addition to what Dr. Hunter just told us, I think communicate with your pediatrician or your primary care physician or any healthcare provider to get the guidance that you need. Also, notify your school to make them aware that your child was exposed or they're exhibiting symptoms, so that that can be communicated as well. And just make sure that we have open lines of communication on truly how to support both the family at home as well as any exposure that may happen within the schools.
Mr. Walker, in your opinion, what would be the best way that the school district could communicate with parents? Are there things that they should know about that could be more optimal to helping you, especially in this year where we're suddenly getting back to school full time?
Well, I just think one thing, I just build on what they already do well. As a parent, had kids in metro public schools for well over 10, 12, almost 15 years now. Especially the last 5 years, the communication has been excellent with the call outs, with the email communication. Just really build on those strengths of communicating to parents that whatever incident occurred, if there is an outbreak, if there is a positive test, just building on what they already do well, which is those, particularly the principal call outs and the email communication. That's been, in the local school setting, from my experience, that's been some of the best communication we receive.
No, very good. Anything anyone would like to add to that in terms of communications and ways that we can basically ensure that the community is informed?
Yeah.
Sorry. Go ahead, Berthina. Oh, I was just going to say, our school nurses are able to give rapid tests in schools. And so just to remind parents to fill out that permission form. And because, that's a pretty quick and easy way. If you are informed that your child has had a close contact and you've already filled out that permission form for the rapid test, that's a way for us to get kids back into school as quickly as possible.
And Dr. Nabama-McKinney?
Yeah, so I just want to add on that so among the PAC, we have seen an increase in communication from the district. And I do want to give credit to Dr. Battle and her team for we have had mass communication. So when Mrs. Buggs talked about parents really getting their hands around the data, we already have meetings scheduled with Dr. Changus and the district to talk about the student dashboard, to talk about the navigators and all of the other different programs, and to truly help educate parents and receive feedback from parents on how the programs and the implementations are going, so that we can maximize and build quality into our programs and increase that in communication. So I'm really excited about that, and I'm excited about the sessions that we have with the PAC that will be rolling out monthly to increase communication with parents and really use parent voice as a catalyst for the great work that we're about to do in the district.
Well, thank you. And we're just a few minutes before the conclusion of this conversation. But Dr. Hunter, is there anything that we haven't touched on in the realm of your expertise that you would like to add?
Well, I did think about it later, that you had a question about face shields. And I don't think I mentioned them when I was talking before about masks. Face shields are are most helpful actually when you wear them with a mask, because they do protect your eyes, and they do limit the spread of droplets from the person wearing them, but they don't actually provide much protection for the person because from respiratory droplets. So someone behind you or to the side of you, they don't cover, they're more of a general covering versus a more snug covering around the nose and mouth. So while there's probably some narrow uses for them in the school setting, or if you have a special needs child, something where you might need a face shield, I would probably just take that on a case-by-case basis. But in general, the masks are preferred to the face shields.
Well, thank you very much, Dr. Hunter. I'd like to end with each of you. If you have any final words of advice or wisdom for the audience, certainly now is the time when we'll go backwards, starting with Mr. Walker and going around.
Sure. I think the first thing I would say to all the parents is just be patient, is to provide just a lot of grace to teachers. We're now going to our third year where learning and education is being impacted by this pandemic. Teachers are tired, and we just need to be as patient as we can as we navigate through this together. I don't know, and I just personally, I don't know that or believe necessarily the masks will be here the whole school year. I believe Metro is following the science on this, and as the situation improves, we may go back to something optional. So I just encourage parents to be patient with local school officials as they navigate this, because we're really trying to do, and they're trying to do everything they can to protect all kids so they can be there and they can learn.
Thank you very much, Mr. Walker. Dr. Nabal McKinney.
Yeah, to build on what Mr. Walker mentioned, I think the priority here is to make sure that our children don't lose out on any more experiences, and to have great learning experiences. And so what we want to do is really work as a community. And I encourage everyone to work as a community to ensure that we are minimizing as much outbreak as possible so that our children can stay in school, and so that they can have the wealth of learning and excitement and activity that comes with being in school. And so I'm inviting parents for everyone to kind of do their part. And if it means unnecessarily to you wearing a mask, do it anyway, because we want to get kids in school. We want to keep them in school, and we want to minimize any disruption that they may have in that experience. And I think the more that we model that it's okay, the more that they're going to be okay in this process, and they're going to jump on board. So I just want to ensure that we, that we empower parents to work together. This is a community effort. This is a collaborative effort, and we all have to do our part to kind of make sure that that happens. Thank you.
Thank you very much, Ms. Masters.
Yeah, I just want to share one other little piece of information that I've been sharing as parents email me, and that is that we have put a significant amount of our ESSER funding, the federal funding for COVID relief, into HVAC upgrades. And that is one of the big recommendations around improving indoor air circulation. We put lots and lots of money into making sure that all of our schools have the appropriate ventilation and filtration. So, as a parent, that helped put me a little at ease. And then also just to echo what everyone is saying, the reason for the mask mandate is it is a tool that we have that we know can help ensure students are able to stay in school and learn in person. So, that is at the heart of it, the reason behind it. It is about having the best interests of our students at heart.
Thank you very much, Ms. Buggs.
Because we're fresh off of that meeting earlier today, I can't help but think about something a clip that I saw afterward, where a parent who was opposed to our mask mandate said, "America is not about the good of the collective. It is about individual liberty." And I wholeheartedly disagree. And so I won't even try to go down the emotional rabbit hole, but we're going to wear our masks. I'm going to make sure that my son is feeling comfortable and as supported as possible. And as soon as he gets home, I'll love on him. We'll, look at each other's mouths and talk. But I do want to remind parents, offer yourself some grace. You are keeping yourself and your children alive in the middle of the most deadly pandemic in over a century. Give yourself some grace. Give them some fish sticks, read them a book, hug on them. I mean, really, because there's just been so much stress. We're going to try our best to keep them safe when they walk outside of our homes. But when they're in our homes, remember that you are their advocate. You are their teacher. You are their friend. Offer yourself some grace.
Thank you very much, Ms. Buggs. Dr. Hunter.
I just want to say I am so thrilled and pleased and happy with Metro School's response during this pandemic time. I, as a parent, am just thrilled, including a pediatrician. We actually kept my rising second grader home last year, the whole year, because I have a high risk, a spouse with high risk conditions, and we weren't sure when the vaccine would become available. And so he ended up homeschooling our son, and I had incredible privilege to have that parent home with him. But I have been so pleased with Metro's response. I think they're following the research and the data, and that if we follow these public health precautions, all the things they're doing with Meharry and contact tracing and wearing masks and physical distancing and getting vaccinated when you can. There is very low spread of COVID in schools. And we know this from schools across the world. I mean, we're not the only country that's been dealing with this pandemic and trying to educate their children at the same time. But I think Metro overall has done a great job, and I am so happy to be on this panel with everyone.
And we definitely have some questions coming in that we will follow up with the panelists on. Among them that we'll ask to follow up includes enforcement of the mask mandate and others like that. So we will definitely get answers for you. Before we conclude, I want to turn it over to Dr. Nabaa McKinney, who wants to tell you about the Parent Advisory Council, our partner in this conversation today.
First of all, I just want to thank you, David, Emily Masters, and Christian Buggs, as well as you, Dr. Hunter, for joining us tonight and partnering with us in this event. We're really excited with the PAC and the work that we are doing with the district-wide PAC. We will have our first Parent Advisory Council, quote-unquote, PAC meeting. The first one of the year will be on Tuesday, August the 31st at 5 p.m. We are also now becoming on social media handles. So we do have Facebook and Twitter. We will also be adding an Instagram to better communicate. If you need to reach us, please email us at MNPS PAC or MNPS PAC at gmail.com. We will be happy to follow up with you and get you connected. Also, we want the PAC meeting will be held at the MNPS Support Hub building. So we would love for you to come out. We are still recruiting PAC members. So if you are at a school and you do not have PAC representation, we invite you to join the PAC at the district level and represent your school. As Ms. Buggs said, we have 159 schools across the district, so we would love to have representation from all 159 schools across the district. We really need all of our parents' voice as a part of this conversation and to create the true partnership that we need between our district and our parents and our community. We really want to leverage parent voice, and this is the opportunity, and we're really excited to create this shift and this opportunity and really create the strong partnership that we look to see for the success of our children. So please reach out to us. We're excited to have you.
Well, thank you so much for that announcement. Great. I'm grateful to our panelists today, Dr. Rosemary Hunter, School Board Chair Christian Buggs, School Board Member Emily Masters, Parent Advisory Council members Dr. Berthina Nabaa McKinney and Mr. Kevin Walker. I want to thank you as well, the audience, for all your questions. You can reach me at dplazas@tennessean.com. Continue to follow our reporter Megan Mengram on Twitter or via tennessean.com. And a big thanks to our video producer, Jeremiah Rhodes. We're very happy to produce events like this and are looking for more ideas for conversations that will be relevant to you. Thank you especially to our subscribers, but thank you to our entire community. And good luck to our children who are going to school next week. Best of success to you and have a great rest of the week.